Today we're going over the easiest ways to remember the cranial foramina, including 2 foramina that you want to be careful of on your next test. So let's grab our skull here, and if we pop off the top and look down into the cranium from above, our first cranial nerve, the olfactory nerve, passes through the cribriform plate, which you can see here. Now the olfactory nerve sends a bunch of nerve fibers through the cribriform plate to reach the sinuses where it can detect smells and odors. To remember this, just think if you can smell a plate of food, it's because the nerve is passing through the cribriform plate. Or if you're having trouble remembering the term cribriform, just think this is the first cranial nerve, and what's the first bed we sleep in as children? A crib, and that'll remind you of the cribriform plate. Next up, we have the second cranial nerve, the optic nerve, which passes through the optic canals right here and right here. So it goes straight through into the orbit like so. So it's pretty easy to see on a model, but if you're looking at a diagram, the way I remember this is I basically just see this area right here. It basically reminds me of the old turtle from Kung Fu Panda, as you can see right here. So where his eyes are, that's where you'll find the optic canals leading to our eyes. Next, we have the superior orbital fissure, which is tucked underneath this process right here. So you have to look underneath to find it a little bit right here. So it's usually a little bit bigger than this in real life, but this model is kind of fused together. Now, if the optic canal is like a stretch limousine for one VIP nerve, the superior orbital fissure is like a subway car packed with 6 nerves and multiple vessels. And why a subway car? Because again, you have to look underneath to find it. Now, every nerve that allows the eye to actually move passes through here. So that's the ocular motor nerve, the trochlear nerve, and the abducens nerve. They all innervate the muscles that actually move the eye. The superior orbital fissure also contains the 3 branches of the ophthalmic nerve, which is actually a branch of the trigeminal nerve itself. So just FYI, that's the frontal, lacrimal, and nasociliary nerves, all branches of the ophthalmic nerve. So it sounds like a lot, but just remember it like a subway car. First you go underneath to find it, then the train starts moving, and that reminds you of the 3 cranial nerves that actually move the eye, and then you get off the train to remind you of the branches of the ophthalmic nerve. For the next foramen, if we get a little closer, you can see we kind of have a diagonal row right here, and so it's important to remember this kind of diagonal row. So this is the foramen rotundum right here, the foramen ovale, and then the foramen spinosum. So to remember the order of ROS, I use the mnemonic rule out syphilis, which sounds very weird, but it will make sense in a second. So we have these 3 foramen, but what goes through them? Well, the trigeminal nerve has 3 branches that go through adjacent foramen. So we know the first branch goes through the fissure, the superior orbital fissure. So that's right up here. So the next branch must go through the next foramen right next door. So this is the foramen rotundum, and this is where the maxillary branch goes through. Next up, we have the foramen ovale, and that's where the last branch, the mandibular branch, goes through. A few other mnemonics you can use here is you'll rot in max security prison. That's to remember the foramen rotundum and the maxillary nerve. And another one is a real man drinks Ovaltine. That's for the mandibular nerve passing through the foramen ovale. The next foramen in our line, in our diagonal line right here, is the foramen spinosum, which does not carry a cranial nerve. Now the reason I like the mnemonic rule out syphilis is because it's very memorable, obviously, but it also reminds me that this is where you'll usually find the meningeal branch of the mandibular nerve and the middle meningeal artery and middle meningeal vein. And since syphilis can cause meningitis, it reminds me that this is where you'll find a few of the meningeal related nerves and vessels. Syphilis also reminds me that the cranial nerves avoid this foramen. Now let's talk about this big foramen right here. This is the foramen lacerum, and I think of it like the trapdoor or the fool's gold of the cranium. Why? Because it's big, and it's right in the middle, so you would just assume that something big and important passes through here. But in actuality, this hole is filled with cartilage in people after birth. So it's not even a real foramen, it's just a cartilaginous junction, and most models and diagrams don't make that clear. Which is why I think of it basically as a trap. It looks so important, but this is the way I remember it. If you're talking about cranial nerves or big vessels, and you pick the foramen lacerum, it will lacerate your grade. Like most trapdoors though, there is a little bit of a secret here. If you look at a different angle, you'll see that there's another opening right here. It doesn't really look great on the model, but where I put these black dots, this is the exit of the carotid canal. The internal carotid artery comes up through here and then runs across the foramen lacerum, which again is just cartilage at this point, and it provides like a floor for the carotid artery. But again, the lacerum is a trap to distract you. But if you look just a little bit closer, kind of hidden away right here is something important, the carotid canal. So if we keep moving down posterior, we come to the internal acoustic meatus, or meatus if you're in the UK, and you can recognize this because if you imagine a straight line from the external acoustic meatus, right here, your ear canal, so if you think about a straight line going through there and it kind of adding up, that's how you can recognize that this is the internal acoustic meatus. Now in my mind, I do like to pronounce it meatus like they do in the UK because it reminds me that this is where two nerves meet and face off, the facial nerve and the vestibulocochlear nerve. Just like in the Thunderdome, two nerves enter but only one nerve leaves. The vestibulocochlear nerve ends its path inside the inner ear, in here, but the facial nerve actually does like a Z pattern and then comes out the bottom of the cranium right here at the stylomastoid foramen. So this is kind of like where two processes meet, the styloid process and the mastoid process. So the facial nerve comes out of here where these two processes meet at the stylomastoid foramen. All right, so that's the internal acoustic meatus. Let's move on to this big foramen right here. And just a little bit of a warning, this mnemonic is a tiny bit spicy, so just a heads up. So this is the jugular foramen, which carries the cranial nerves 9, 10, and 11. To remember this, I use the mnemonic JUGS XXX. This is to remember that this foramen has the first three cranial nerves with an X in their number, so 9, 10, and 11. Now, if we look at the underside of the cranium, we can see the jugular foramen right here, very big, very important. But another foramen to keep in mind is the carotid canal. The entrance to the carotid canal is right nearby. So obviously, the jugular and the carotid are very interlinked. So if you find the jugular foramen, you just have to go a tiny bit anterior and you'll find the entrance to the carotid canal right there. So that's the jugular foramen, which carries cranial nerves 9, 10, and 11. So you would kind of assume that the 12th cranial nerve, the hypoglossal nerve, would go through the foramen right next door, right here. But again, this is a little bit of a tricky area. So this is actually the condylar canal, and it's named because it comes through the condylar fossa on the other side, right there. So this is the condylar canal, and it actually just carries a small vein. So I think of it as the con man of the cranium, because again, it looks like it would carry a cranial nerve, but it does not. If we're looking for the hypoglossal nerve and the hypoglossal canal, the trick is to think of hypo means below or under. So the hypoglossal canal is actually kind of below and under. So if you can see it right there, let's go through there. So you can see it's kind of hidden underneath. So I think of hypoglossal, that reminds me that I can't just go for face value and pick this guy right here. I have to look under, look a little below, and that's where I'll find the hypoglossal canal, and that's where the hypoglossal nerve, cranial nerve 12, goes through. And finally, we have the foramen magnum right here, which is Latin for the great opening, because this is the biggest foramen in the skull, so pretty easy to recognize. All right, so hopefully some of those tips helped you out. As always, thanks for watching, and of course, good luck on your next test.